A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. So today we're here with the Health and Wellness Committee at Masjid Al Mukmanoon, and we are discussing hypertension. So you guys want to start off with Al-Fatiha? Let's start off with Al-Fatiha, inshallah. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Alhamdulillahi rabbil alameen. Ar-Rahmanir Rahim. Maliki yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdina siratal mustaqim. Siratal ladhina an'amta alayhim. Ghayril maghdubi alayhim waladdallin. Ameen. Okay, so my name's Brother Hamad Tony, and I'm with Sister Amita Abdullah. We're gonna take turns and discuss what hypertension is. I would like to make this a little bit more interactive, so I'm not sure if I have to pass the mic around, but we'll figure it out as we go along. So briefly on the outline, we're gonna define hypertension, discuss how it's diagnosed, who is at risk, signs and symptoms of hypertension, the management and treatment of hypertension, and also some takeaway points. Sister Amita will also show a YouTube video. And after you leave, we have some pamphlets on the side about hypertension and how it will affect you. All right. Yeah, so how many of you guys know what hypertension is? And what is hypertension? Brother Trent, you tell us what hypertension is.
It's a body condition where it's a body condition where your blood pressure is too high, and that can damage your arteries and eventually lead to other complications like heart attacks, strokes, etc.
Did you have something to add, brother?
No, not really.
Okay. All right. Shukran, Brother Trent. What is hypertension? Hypertension, also known as high blood pressure, is the measure of force exerted by blood against the walls of our blood vessels. It's typically measured by two numbers. Who's familiar with the two numbers of high blood pressure? We have dystolic and systolic. So systolic is the top number, and it measures the amount of pressure on your blood vessels when your heart is contracting. The diastolic, which is the bottom number, measures pressure when the heart relaxes. So also, as a little disclaimer, I'm not a physician. We're giving you helpful information, and with the hope that someone in here, or more than one of you guys have high blood pressure, can see a physician and get it under wraps. So we also have a blood pressure monitor. It's optional. If you voluntarily want to take your own blood pressure, kind of get an idea of where you're at. Because they do say that 50% of people that have high blood pressure don't even know they have it. So your blood pressure is measured on your brachial artery, which is located in your upper arms. One thing to note is that African Americans have a disproportionately higher rates of hypertension compared to other ethnic groups in the United States. Did you guys all know that? Some people, it's common knowledge. We don't all know that, but African Americans, historically have like a higher percentage of high blood pressure. Does anyone know what a normal blood pressure is? 120 over 80. Good deal, Trent. And what is elevated hypertension? What range would it be in? Exactly. Well, you're close. 130, 139, no, 129, up from 120 to 129 over 80. So then you have stage 1 hypertension, which means your blood pressure is 130 to 139 over 80 to 89. Stage 2 hypertension is when your blood pressure is greater than 140, and the bottom number is greater than 90. All right, so just to note, we kind of recommend that you guys all get your blood pressure checked kind of on a regular basis, um, because a lot of times there's no way to know that you have it. You know what I mean? And they call it a silent killer. Am I right? Because you don't know that you have the high blood pressure, and you can be in a hypertensive crisis if your blood pressure, the top number is over 180, and the bottom number is over 120, and that's considered an emergency, and it warrants immediate medical treatment. You could probably put yourself into a stroke or close to it at that point. So at that time, you need to call 911. All right. So how do we know how hypertension is diagnosed? What they're doing right now, doing to the demonstration. Okay, Trent, you good? You checked yours?
Yeah, I'm 131 over 79, so.
Oh, that's pretty much.
But, you know,
Mashallah.
that's what I'm normally at.
Okay,
Standing.
that's a good range. Yeah,
It's
I would like to have that one. Sometimes mine is higher than that, but that's a good range though. So to officially diagnose hypertension, you have to have 3 different blood pressure readings, 1 week apart. So I have one this week, the next week, and the following week. The blood pressure should not be checked over clothing. Sometimes if you go like to a nurse or somewhere, they will check it over clothing. I think if it's thin, it's not such a big problem as if you had like on a big sweater, it's probably not going to give an accurate reading. And it needs to be checked consistently on the left arm with the arm at heart level. Wrist readings are not accurate. And I've seen some of those on.
They have those machines, and they say they're not good. They don't. Yeah, they say that the wrist measurements are not that good. They said it's better to use a regular one that you do on your arm. And I think that the left arm is probably more accurate than the right arm because it's closer to your heart. Yeah.
Does it mean that the band should be put over the pit or
Over the pit,
above the pit?
above the wrist, above the wrist.
Above this part?
I mean the elbow. I mean the elbow.
elbow, right?
Yeah, yeah.
Okay.
Okay. Your legs should not be crossed, and you should have your feet flat on the floor. And you should avoid caffeine and alcoholic beverages prior to measurement. They all have the effect on the reading. So, but you have to do a couple of readings. You can't just diagnose off of one reading. And if you notice, if you sit before you take it a few minutes to let your body settle, and as you take it, and then you wait a few more minutes, you can take it again, and generally it will go down as you sit there, the longer you sit. So, that's how you diagnose.
Right, and also I'm gonna get to you guys in one second. Also, like if you run up the stairs or walk, go upstairs and then you sit down and take it, give yourself a little chance to rest. It's probably gonna be high. I think they have something called like the white coat syndrome or something, which means like if you go in a doctor's office, you're a little bit nervous, so it may be like high because you're there in the doctor's office, and sometimes you need to give yourself a little time to settle down. You guys have a question?
I got a question and a comment. So, yeah, is there any good time in the morning or in the evening or any time of day that's best to get the best reading? Like in the morning or in the evening, or you should just really be sitting for a while comfortably?
Yeah, it's so you should be relaxed and you should not like have to use the restroom. So it says you should have an empty bladder before you take it as well.
One time I was going to the doctor and I had a stressful phone call before I went in there. I was all upset, and I went in there. It was like 180 over whatever, it was high, and I said, what's wrong? So anyway, I said, I'm just upset, so I'm good. I'm good. So, anyways, you don't be stressed out. Have a conversation or have an incident. If you're driving and you're going with a doctor or whatever, and you're having a kind of road rage, you don't want to just kind of be calm and still.
Yeah, because if you have road rate, everything's gonna be up. Your heart rate's gonna be up, blood pressure, and everything else. Brother, do you have a question?
Yes. Assalamu alaikum, Dawood. I was wondering, my nurse practitioner had suggested to me that I take the readings if I'm going to self-diagnose myself, right? If I have a blood pressure machine, that I consistently take it all at the same time of the day. If I take it in the morning, I make sure that I take it 3 times that week in the day, or if I take it in the evening, I have a set time in the evening that I take it, so I be consistent on when I take it, so I could make an accurate recording of that blood pressure reading.
Yes, sir.
And also, do anybody know why I can't take it standing?
Because you're using energy, and
stand.
it would be more stressful.
Right.
I would imagine, I'm just guessing.
Okay, okay. Thank you. That was just a question.
Yeah, I would think standing it will probably be higher because you're using some force in your body to stand. So why is hypertension important? As we discussed earlier, hypertension is often referred to as a silent killer because 90% of the time it does not come with any symptoms. It silently creeps up over time until it gets really high. It also silently causes wear and tear in the blood vessels over time, leading to heart attacks, strokes, aneurysm, kidney damage, and blindness. The organs usually affected by hypertension are the heart, the brain, the lungs, the kidneys, and the eyes. And as I was doing my research, I've learned that when your blood vessels are like stretched, they leave like little kind of openings in a blood vessel. So, and it allows for, like if you eat a lot of fatty foods, for them to start to build up in those little areas, and it can become more and more. Which, if they get it's enough inside of those blood vessels, it can cause a heart attack as well. Yes.
What he's talking about really is what they call atherosclerosis, and that's what they talk about cholesterol. That's when the cholesterol builds up on the walls of the arteries, and so it makes pressure greater because the vessel is, gets narrower, and so that's one of the things that can happen, by eating certain fats and things. And that's just there's so many things that can be, attributed to the hypertension. Starts out as hypertension.
I'm told that the cholesterol is really like a Band-Aid over the cut that you were referring to, like a little slice in the artery.
Yeah.
And then the body responds by putting this little patch of cholesterol over it. And it's that constant building up, a constant slicing and building up, slicing and it closes the artery.
It allows more to build up on top of that.
Yeah, it's like scar on top of scar. Correct.
And I know that they say that there's a difference in the particle size of the cholesterol. It's better to have the big particles. When you have the small, it's worse, and that's why you can ask to be tested to see what is the particle size, when you find out that you have a collection. And actually, the collection and the narrowing is called coronary artery disease. And, so you really have to be mindful about your diet, all of that.
So, who's at risk? Who has risk factors? Yes, sir. You do? Wow. SubhanAllah. So, check it again before you leave after you sit down and relax for a little while. But, yes, sir. You have a question?
What I was saying is absolutely true. A lot of times Assalamu alaikum. Yeah, a lot of times when you take it, the best way to take it, from I find from what they tell me, is to sit down, maybe sit for a few minutes. You know, I do mine early in the morning before I eat, drink, anything like that. Everything is calm. Put my arm on the table. I'm sitting down, legs not crossed, like they were saying, and then take it. Now, you get to reading like that. The middle of the day, it may be up, it may be down, you may be running, you may just, anxious, whatever it is. But if you do it early, that's what I find for me. And I do it early in the morning. I'm not thinking about nothing. I'm relaxed. I just made my salat, so I just go do that, and I say, okay, it's good, or whatever. Then I can, and if I, like I said, if you do it every day like that, then you get a better reading than like in the middle of the day, because you may be going here, doing this, and this, your anxiousness or something in your mind could make it go higher. So that's what you gotta like also think about when you take your pressure. You may be anxious about something, or you gotta meet somebody in 10 minutes or something like that. So those things you don't feel it, but it's going up. You don't even know it. So it's fluctuating. So that's why, what happened with me one time, the doctor came, or the nurse that is, and they'll take like one pressure now, then they'll wait a few minutes. Then they'll take another one. They'll take 3 of them, and then they'll see like where you at, like with that. So sometimes, like healthcare people do things like that. Inshallah.
Okay, so some of the factors that make us at risk is our age, old age. They usually say 50 to 55 and older. Definitely race, African Americans, especially African American men and Hispanics. Also, it could be hereditary if you have family history of high blood pressure. If you have a sedentary lifestyle, you know, um, if you're obese, it can affect it. If you have a lot of salty foods, high cholesterol, or have a processed food diet. I'm not too familiar with like sleep apnea, but if you have sleep apnea and it's not treated, it can affect it as well. Of course, smoking, heavy alcohol, and caffeine use could affect it. And as we discussed earlier, you shouldn't be have caffeine before you take your test. So if you had a cup of coffee before you took your test, it could affect your blood pressure as well.
Question.
Yes, sir.
I was wondering, why do African American have higher rates of hypertension than other races?
We're gonna talk about that.
Oh,
Yeah, and it said it's genetic, and it's also
Genetic, and, we have to consider the stress that we have to consider the stress that we've always been under. The circumstances when he came over here, the way we came over here, all of that plays into it. We tend to have, normally, when I say normally, we tend to have higher blood pressure than the other Europeans,
And then, can I say something too? Sometimes, I don't know with this one, but I know I've seen some things they talk about that
I have,
when they do these numbers, when they have these broad numbers, they take thousands of people, and what happens is there's more European people that take this, so the numbers for them would be maybe different than ours. So we got to put that into account when we look at, what I'm saying, these numbers and stuff like that. So, like I said, from what I could see, and God knows best, Allah knows best, is that taking it every morning, or even if you want to do it in the evening, I prefer the morning, because then you're not eating, you're not doing anything, and then see what it is, see the next morning, whatever it is, and then you can get a little peek of where you at. But if you do it in the middle of the day, you just came from playing basketball and you come sitting down, that's no, because your heart is still beating fast. So you want to like try to do it, you know what I'm saying, at a time when you relaxed in the morning or something like that, inshallah.
thank you. Okay.
Okay, so the question was asked, why do African Americans, why is our blood pressure historically higher? Some of my thoughts are our diet, and like we're known for not going to the doctor unless something's wrong.
That's true.
You know what I mean? And also,
A lot of people don't have access.
right, we don't have access to a lot of the health care that other people have. So they could get a grip on it like early and figure out what changes they need to make where we don't know, and that's why they say what I say 50% of people that have high hypertension don't know about it, and probably the greater amount of those are like African Americans or Hispanics. Does any Yeah, go ahead, you had a question?
Yeah, I'm curious about the role of music. Does music rate when a person's sitting down and they get tested music, they want to test, does music raise blood pressure? I'm saying that because I know when I would be driving, if I'm listening to fast music, I'll start speeding. I really do. I'm not joking. And I don't realize, oh man, I'm going so fast. But it was the music that had me going. So I'm just curious the role of music and the term, the song they say, don't believe the hype.
Yeah,
It's where hyper is connected to
Public
hype.
Enemy.
And so
Yeah,
we are, as people, under a lot of tension,
right.
just in general. Not only us, as other people too, but the tension. So the hypertension can also apply socially, is my point.
Right,
What I'm saying, and I'm wondering the role, but just in general, just always being stressed, going different places. We got to deal with each other. We know how we are.
right.
We be in tense situations. Isn't that
Right. The brother's asking about being in stressful situations, listening to like hyper type of music. I think this is my personal opinion. I think it would raise it. As also, I think if you were meditating in a calm state, or if you get finished praying and you're in a calm state, it would lower it. So us as Muslims, I think we do have an advantage, especially when we're fasting during Ramadan too, because we don't have all of those. You know, salt and everything in our body, the sodium, because sodium raises it as well. Okay.
Black, black people tend to be salt sensitive. It will react on the black people with the salt. That's an issue for a lot of black people, and they call that salt sensitivity.
I'd like to add to that, we don't drink enough water in general,
Yeah,
which will increase
yeah,
the concentration of salt in our blood, and the
Yeah.
sugar too, but
yeah,
salt. That's right.
yeah.
I agree.
So what's next?
I agree about the water, like clean water and like filtered water or spring water. Like we as African Americans, a lot of us don't have access to it as much as other people. We might drink tap water, which may have contaminants and things in it as well. And some of the symptoms, unfortunately, the symptoms appear when the crisis sets in and organ damage has already occurred. Like, and that's for us African Americans, as I stated. Like a lot of we're known for not going to the doctor unless something's actually wrong. I'm guilty of that as well. You know what I mean? So, it's why is it? I think it's like we like growing up. We're not like socialized like that. We maybe living in the moment and not thinking about like 20 years from now or 30 years from now. We into what's going on right now. But as you become more knowledgeable about it, probably through your family, your parents, your grandparents, is passed down to take care of your health so that you can live longer. Inshallah.
I wanted to mention also that we have been the subject of a lot of testing and experimentation, and that is one of the major reasons why black people tend to distrust the medical industry. And, like the Tuskegee experiment, when they had given syphilis to the brothers and they didn't treat them. They just wanted to see what the symptoms were, et cetera. And so, I mean, until they die, yeah, yeah. So, it's those kind of things that, you know, have play into the reason why we have these issues. But like I said, I would like to, inshallah, show you a video about some of the reasons why.
Yeah, that's a great point that you just made, and I wasn't thinking about that. But like a lot of us don't trust like going to a doctor because of just historically what we've been through in the country. Like we think that we're already they treat us secondhand, that they're not going to give us like the optimal care. I appreciate you bringing that up. So some symptoms of the organ damage include headache, blurred vision, dizziness, shortness of breath, and chest pain. Okay, I was gonna ask them. So what do you guys? How will you do you guys think we can manage and treat hypertension? Before you look on the screen, how can we do it? Drink more water. Okay, I agree with that.
Exercise,
Exercise, most definitely.
meditate,
Meditate.
try to stay out of conflicts, with family and others that you come across, just situations where, it's a stressful situation that comes up.
Right. Keep a peaceful vibe.
Right, right.
Yeah. Stay away from negativity.
More healthy eating.
Healthy eating, definitely.
And I'm going to add, stay curious and increase knowledge and understanding, because I think the stress comes a lot when you run out of resource in the argument, in the conversation that one don't know once it gets angry.
Right. The brother said increase your knowledge and become more curious. Okay, so initial management of hypertension is lifestyle changes before starting the medications. Lifestyle changes include following a healthy diet, avoiding salt, fatty foods, processed foods, focus on eating holistic foods like vegetables, fruits, lean proteins. It's not about calorie restrictions, it's about nourishing your body with high quality foods. Exercise, that was also mentioned. Get at least 150 minutes of aerobic exercise per week. And that's just walking 30 minutes a day, 5 days a week. And I was watching a doctor on YouTube, and they were saying you can just, after every meal, we eat 3 meals a day, just go for a 10-minute walk. It'll be definitely beneficial to your health. Cut down on caffeine. So instead of like 3 cups, kind of limit yourself to one. Have a cup in the morning, and maybe your next cup may be decaf or something. And I have to do that myself.
What's too much coffee, though? I mean, how much is too much?
For me, I limit myself to one cup of caffeine, 1 cup of coffee, and if I do need or have to drink like an energy drink or something like that, I'll drink half, because a lot of them they have as much caffeine or more, and that's rare. It's rare. I may drink one maybe once a month. If I got to cut grass, I know I got like a heavy day, and I'll just drink half and put the other half away.
I'm told also that if we're trying to keep up with our water intake,
Yeah,
that for every cup of coffee that you drink, you lose that much water.
drink a cup of water right behind it.
For every cup of coffee that you drink, you lose that much water plus 30%.
Yeah,
You lose actually more water than was in the cup.
right. Because
It's dehydrated.
you're gonna eliminate that, right?
You know how much water you're supposed to drink?
I do.
Okay. Questions asked. Do you guys know how much water you should drink?
So it's half your body weight in ounces.
That's right.
Half your body weight in ounces.
Yeah, the old knowledge used to be 8 glasses.
You want to talk to him about that?
Yeah. No, he had it right. That's correct. We generally don't drink enough. And then, of course, you talk about different types of water that are, good for you. You have the filtered water and spring water and distilled water, But from my research, they say that spring water is probably the best. Of course, Allah provides that
It was half your body weight, what?
in ounces.
So if you weigh 200 pounds, 100 ounces.
Say what?
If you weigh 200 pounds, then minimum should be 100
100
ounces.
ounces, okay.
And they also said, I should add this point, that just like the earth has fresh water and salt water, your body has fresh water and salt water. The water inside the cell is fresh water. The water around the cell is salt water. and these two oceans have to
You need
stand
to, you
down.
need to work on that one.
No, I read a book called Your Body's Many Cries for Water.
Yeah.
So it's huge and it really helped me. And then the
Yeah.
same guy has excellent book, excellent book. And he has a
Appreciate it. Appreciate that. So just to be noted, if you're on medication for high blood pressure, take your medicine every day and never stop it unless instructed by your doctor. And I would think that if your body is used to having that and you stop, it's gonna bounce back like pretty high because you're not taking it. Most important of all, know your blood pressure and check it regularly.
I have a paper here that I printed up with the different types of medications, the different names, and also the different mechanisms that they have. But there again, like on the video that I wanted to show, they talk about why black people are only prescribed certain medications, and they don't have access to all of the different modalities. Yeah, yeah.
All right, just to wrap this my portion up, we're going to do the takeaway points, and it's hypertension, high blood pressure affects over 1 billion people in the world. African Americans are disproportionately affected by high blood pressure. Hypertension is a silent killer, as it does not come with any symptoms until it's too late. So what that's saying, a lot of times you find out that you have high blood pressure, but a lot of damage has already been done. Hypertension is the major cause for organ damage, leading to heart attacks, strokes, blindness, and kidney failure. Risk for hypertension and organ damage can significantly be reduced by following a healthy lifestyle. And I would also add getting checkups as often as possible. All right. Any other questions? All right. I appreciate it. Appreciate it. Jazakallah khair.
Hold on. I'm gonna see if I can do this. Find the YouTube because I thought
There, you think you had it?
what'd you say?
Yeah, I saw a video pop up. I think you had it.
Okay, we're going to watch a brief video.
I gotta go to YouTube and see if they have it for me.
I saw a screen pop up. I think you had it already on there.
I did, but then
There it is.
I
See
had
it on the bottom right? You can't see the bottom right.
With-
Bottom right corner?
this.
With these doctors here.
Yeah.
Well, no, it wasn't on this page.
Oh, okay.
YouTube. And, why doesn't it just go to YouTube? Watch.
What do you think of the video?
Yeah, that's just the rating screen.
What's the title?
That's just it's, why are black patients treated, different?
Okay,
That's the type that is.
yeah.
Why doesn't it just come up if I click on it?
Because it's rating it. It's
That's
like you
not-
already seen it. With a 5-star.
Where does it say? Why? Beyond, no, rest is hard. I didn't put that in there.
Hit that X. Right. You can type it onto
High blood pressure in the black community. That's a short video though.
This is one of them, this one.
Okay.
That's, I mean, it was two of them, that's one of them.
No, we have volume on this TV.
There are a lot of factors that cause the disparities. So it's interesting that worldwide, there's not necessarily a distinction or a difference. There is something special about being in the United States. There are, the stress of racism. Is definitely a factor. We also know there's some genetic factors with African Americans that we tend to be more salt sensitive, which can then lead to high blood pressure. There are also just some other factors. Being obese or being overweight increases the risk of high blood pressure, and unfortunately, African Americans have higher rates of being overweight. There's some genetic factors, there's some social factors that lead to, unfortunately, higher rates of high blood pressure in African Americans. African Americans, like everyone, should get regular screenings, of their blood pressure. So being seen by a primary care physician on a regular basis will be helpful. Knowing your family history is important. I know I come from a family where pretty much everybody has high blood pressure, and it was just going to be a question of when was it going to hit. Trying to exercise on a regular basis will definitely help in trying to prevent the onset of high blood pressure. Maintaining a healthy body weight is another way that you can maybe stave off the onset of high blood pressure. And then dietary habits. So following a diet that is low in fat, that's high in fresh fruits, vegetables, whole grains, is going to put you on a track to maybe prevent the onset of high blood pressure. And then being physically active, so shooting for, say, 150 minutes of moderate exercise per week, or trying to shoot for maybe 10,000 steps a day, can definitely decrease the risk of developing hypertension.
Racial disparities in hypertension rates. You said what causes it? That's what you're talking about.
That was way. Other one is about the different medications. Why do they treat?
Yes, so some medications African Americans can't take for high blood pressure. They found that they were called scrapping in African Americans.
Hi, it's Dr. BCW. Let's talk about race-based medicine and its impact on health outcomes. For this episode, we are going to focus on high blood pressure, also called hypertension. Historically, providers have been taught to prescribe Black patients a specific class of blood pressure medications, solely based on their race. Even though race is defined as a social construct, meaning it's not biological or genetic. This practice limits Black patients' access to try a blood pressure medication that may be more effective and reduce their risk for developing long-term complications, such as chronic kidney disease. It's important to look at why are we treating Black patients with a narrow class of medications while providing different options for everyone else. The 2022 Journal of the American Board of Family Medicine reported this guidance is limiting access to medications that could achieve better health outcomes in Black patients. Hypertension is referred to as a silent disease, and symptoms are not always present until the condition has progressed. There are several risks to developing hypertension, such as family history, age, underlying health conditions such as diabetes and kidney disease, as well as social determinants of health. However, race is not the cause, and it's important to treat the condition based on the individual, not the color of their skin. If you are a person of color, please have the conversation about race-based medicine with your healthcare provider and ask their thoughts on this important topic. For more information, please check out the UCSF study titled Race-Based Prescribing for Black Patients with High Blood Pressure, shows no benefit. This is Dr. BCW. Thank you for watching Beyond Clinical Walls.
Those are the two videos I just wanted to bring to your attention. And I thank you. Thank you for staying to participate. If you have any questions, we can talk about whatever you like to talk about related to this subject. Oh, yeah. Everybody's taking their blood pressure, and we have different things over here if you're interested.
Take your time out. Mashallah.
Okay, so this is going to conclude the health and wellness presentation for this week or this month on hypertension. Thank you guys for having us.
We'll have,
Have fun.
The ancestry.
Oh,
Brother
yeah.
Lukemon's gonna be doing
How to determine your ancestry.
how to determine your ancestry.
Well, she's the one that's
And,
that.
and, and then the month after that is T, and she's gonna do the
Genealogy.
genotype.
Ge-
Genotype.
No, not genotype. It's I can't.
Genogram?
So next month we're going to do how to determine your ancestry.
Using the apps that are out there.
Okay, using the apps.
Inshallah.
Sounds good. Who wants to wrap us up? Any volunteers?
Right, you gonna wrap us up?
Alhamdulillah. Jazakallah for coming, inshallah. A'udhu billahi min ash-shaytan ar-rajim. Bismillah ar-Rahman ar-Rahim. Wal-asr. Inna la fi kusr. Illa alladhina amanu. Wa amilu salihati wa tawassaw bil-haqqi wa tawassaw bis-sabr. Alhamdulillah. I just want to say also too, man, any other information that you guys have on health issues and stuff, or if you have things that you're interested in, just let me and myself or one of the members know, and we'll try to cover that, that we haven't covered, inshallah.
I can't get two cups of coffee in the morning. There's two. Second one is